Bullying is a big factor in nursing. It's something not anyone would expect. It shouldn't happen, but unfortunately it does. These two scenarios we're about to show you will show one possible outcome if we don't take a stand, and then one if an intervention is taken.
Is there something I'm doing wrong?
Of course you are.
Can you tell me what I'm doing wrong?
Everything's great. Miss Hoover's gonna love that. So just keep doing as you were.
Okay. Hi, Miss Hoover.
Hi.
I'm sorry to be bothering you. I know you're busy, but I needed to talk to you about a situation. Since the first day of school, Brittany and Carl have really been bullying me every day, no matter if it's a skill or if I pass or fail a test, like, oh, I did better. Like, how are you going to be a nurse? And it's really affecting me emotionally, and I feel like I'm getting sick, and I can't really take it anymore, and it's affecting my studies. Is there any way you could help me with this?
Alejandra, you're going to have to thicken up your skin, sweetheart. Nursing, you think it's easy out there?
Well, no.
Those nurses are going to eat you alive if you can't stand up on your own 2 feet and take care of yourself. Sweetheart, there's nothing really I can do for you. You're going to have to learn how to take care of yourself.
Oh, okay. Thank you.
Look who's here then. Why don't they even accept her in this school? Who knows?
Is there something I'm doing wrong?
Of course you are. You couldn't even pass vital signs. What makes you think you can do sterile technique?
I passed vitals.
Barely. That's the easiest step. The easiest thing we could do with this school.
Okay, well, I'm trying just as hard as everyone else.
Okay, well, maybe try and swallow a razor blade or go kill yourself.
That's not funny, Carl. I hate this school. It sucks. I'm never gonna do anything. What was the point of me coming to this stupid school? It just sucks.
Dear Mom and Dad, I'm so sorry it's come to this. I didn't want it to end this way. I tried to be happy. I tried to endure the abuse every day. But it's the same. You said, hey, it'll get better. It doesn't. People are the same. No one changes. Everyone's a bully. Everyone wants to hurt one another. And what's the point of being in a world that's so cruel? I can't deal with this pain any longer, and I'm so sorry. But you guys wanted to be someone I'm not, and I can't. At school, I can't even do simple things. They're right. I should swallow a razor blade because I'm not good enough. All I do is hurt and hurt. And what's the point of someone like me? I'm worthless. So I'm sorry. I love you. Bye.
Bullying is serious. Bullying should not be accepted and done. When adults respond quickly and consistently to bullying behavior, they send a message that it is not acceptable. Research shows that this can stop bullying behavior over time. Parents, friends, school staff, and other adults in the community can help prevent bullying by talking about it, building a safe environment, and creating a community-wide bullying prevention strategy.
Look who's here then. Why don't they even accept her in this school? Who knows?
Is there something I'm doing wrong?
Of course you are. You couldn't even pass vital signs. What makes you think you can do sterile technique?
I passed vitals.
Barely. That's the easiest step. The easiest thing we could do with this school.
Okay, well, I'm trying just as hard as everyone else.
Okay, well, maybe try and swallow a razor blade or go kill yourself.
That's not funny, Carl. Hey.
Hey, are you okay?
No.
You can just stand up for yourself.
I know, but it's hard. I feel alone and like no one understands what I'm going through.
Well, the best thing you can do is go speak with Ms. Hoover and you guys get together, somehow settle this, because what they're doing is not right.
Do you think you can go with me to go look for her? Oh, hi, Miss Hoover. We were actually going to talk to you.
Uh-huh.
I wanted to talk to you because Corella and Brittany have really been bullying me since the first day of school, and it's really affecting me, and I don't want to be here anymore.
Oh, no. Tell me about it.
Every day they're telling me that my skills are bad, that my grades aren't good, and I don't know what to do. And I tried so hard to get into the school, and they're making fun of me, like, how did I get in? Was I the last option? And it's not fair.
Okay, Alejandra, listen. Don't cry, all right? Let's work on this. Let's get this fixed, okay?
Okay.
You deserve to be here. You're doing great. I know that Brittany and Corella are in the lab practicing right now. Are you comfortable with coming in? We'll all have a talk.
Yes.
Okay, let's go in the lab, all right? Hello, ladies.
Oh, hi, Miss Hoover.
I thought maybe Alejandra was sharing something with me, and I thought maybe we could all have a talk. Do you mind?
That's fine.
Crystal is here kind of to support Alejandra. Okay. Let's just all gather around. Alejandra says that both of you have been making fun of her, laughing at her about her skills and her grades, and she feels like she's being bullied. Bullying has led to very tragic incidents in this generation. There's no place for bullying in nursing. Nurses need to have compassion in their hearts for patients that are vulnerable, dependent. They need help, our help. And then it has to transcend over to each other, to peers, your co-workers. It takes a team to care for patients. It takes a team to run a floor. It takes a team for everybody to succeed. Alejandra, if she continues to be made fun of, laughed at, made to feel like she is less, she's at risk of not completing the program. But if you don't take your mind off of doing these things to Alejandra, not being kind or compassionate, then it puts you at a high risk of having the same thing happen out in the clinical, which would put you at risk of also not completing the program. But more importantly, in nursing, we're supposed to be compassionate toward each other. Nursing is very difficult. The shifts are long. The shifts are hard. I know that I've been in situations where I needed somebody to come and help me. God, I'm behind. I have a difficult patient. I have a difficult procedure, and I need somebody that I can trust. Brittany?
Yes, ma'am. I'm sorry, Hannah. I shouldn't be doing that. So I do apologize.
It's okay. You're right, Miss Hoover. I apologize. I shouldn't be hard on you. I do see a lot of potential in you, and we are going to help you. If you want help with sterile technique, we're about to actually go do a procedure and prep. Would you like to do that?
Yes.
And let's continue to grow as professionals, and let's continue to let compassion come into our hearts, all right?
Yes,
And
ma'am.
no bullying in nursing. Thank you.
Thank you.
Goodness, Alejandra, you're gonna have to thicken up your skin a little bit.